It's my privilege to present on behalf of the ICARIA study team the results of our randomized phase 3 trial. This is a really important study in my opinion and reflects the first of its type to be reported in this patient population of relapsed refractory myeloma. We conducted the study in over 100 sites and over 22 countries and assigned patients to either 3 drugs, isatuximab, pomalidomide or dexamethasone, or the current standard for relapsed refractory disease, pomalidomide and dexamethasone. And we're very pleased to see that we see very high quality responses in the 3 drugs versus the 2, and this translates not only into an overall response benefit, but into the primary endpoint advantage, which is a PFS benefit. And we saw a progression-free survival median of approximately 12 months for the 3 drugs, which is very exciting, compared to approximately 6 months for the standard of care, pomalidomide and dexamethasone. What was also very exciting was to see an excellent tolerability profile with manageable side effects for the 3 drugs, best reflected by a quality of life assessment in which there was no loss of quality of life for the 3 drugs over the 2. And whilst there were some higher rates of infection in the 3 drug arm, they were manageable. And what was particularly exciting was in pre-specified subgroup analyses, we saw clinical benefit in all groups. So isatuximab, which is a CD38 targeting antibody, obviously in the same class broadly as daratumumab, but importantly it has differences. It's more specific to a different epitope with more of an apoptotic signal, and that confers certain potential advantages. The other aspect that's exciting is there's less complement activation, which means that there are less infusion reactions, and you can give it to patients who have chronic obstructive pulmonary disease and asthma, and that's in fact what we saw. So recognizing this represents the first of the randomized studies with isatuximab, we're very pleased to see this degree of clinical benefit.